Hello everyone, welcome back to the channel. This is Dr. J, and title of this video is Big Plug Lurking. And you'll see what I mean here in just a moment. You probably saw it from the thumbnail, but this is a fairly large wax plug in this gentleman's ear. He has a history of wearing hearing aids for a very long time. And this is kind of what precipitated this event and this level of obstruction. And so what you see here is this large wall of wax, and you see a slight fuzzy, almost kind of a light yellow to a white layer, almost cotton-like debris, kind of all over the surface, and that's fungus. And so part of this is wax, part of this is old skin, but then a lot of it is fungal infection. We call fungal infection otomycosis, and this looks like it's fairly chronic, especially once we get this bigger piece out. You will see the kind of the debris that's behind it and resting actually all the way on the tympanic membrane. And if you stick it out towards the end, we'll be able to do an eardrum peel there at the end. But as I try and work with this, with my largest suction that I have, you can see that it's just not willing to play ball with us. It's too sticky. And you know what's coming next. Colace. Colace is my friend. And a few drops of colace, and I usually just put it in just as much as we need, and I wait for it to see the whole ear fill up, and you see towards the upper part, and the upper part fills up, and that's enough. And then you evacuate the excess, and then you grab it again with the suction. You just start to move it around a little bit. You're working that colace to get to the layer between the plug and the canal wall. It'll help provide some lubrication, decrease the stickiness of this massive plug, and then boom, we start to see some movement. Once we orient it towards the front, the guy's actually watching on the video monitor, so I'm gonna pause here for a moment so you can hear what he says.
Ah! I found your problem, I guess. That is gross.
And so, yeah, he agreed with me. Yeah, that was a big plug, and it was kind of shocking for him. He had no idea that was sitting in his ear canal. He takes usually pretty good care of his ears, but for whatever reason, this ear was neglected. Now, I'm going to pause there for a moment. I'm going to show you a couple of clips from my last video. So I've got several videos that have went viral that kind of helped showcase my channel, and I've picked up a lot of subscribers from them. But this was early on when I wasn't doing any narration. So if you want to go back and check out these videos, my last video, there's 3 different patients with large wax plugs, and each of them have multi-million views. So if you want to check those out, click on the link here, and let me know what you think. They're all pretty. This one I called it. I struggled with this one because he had such narrow ear canals. It was just very hard getting this thing out from the depths of a very narrow ear canal. And this one here, this is my most popular video. It's over 10 million views. It kind of surprised me how many views it got. But if you want to go check those out, just click on episode, I believe it's 73, and let me know what you think. All right, back to this patient. We've got the big plug out, and we're starting to clean up the canals. Now, when you have an otomycosis in a long-standing big wax plug, the treatment regimen is debridement and topical antifungals with some steroid as well. So right now we're going to complete the debridement, and you want to remove as much as you can within reason without disturbing the patient or making them uncomfortable. Working on the back wall of the ear canal, working down towards the eardrum. And right there we start to get on, that last part was starting to get right onto the back portion of the eardrum, the posterior portion. Here's the bottom of the ear canal. Just trying to work it up, and it's this layer that we're picking up is a little bit of old skin, but most of it is just fungal debris, and the fungus will just kind of grow and multiply in that location. There we go. We exposed the eardrum there with that little piece that came off, and it just kind of cakes on everything, and it can be very time consuming at times to perform. There, that glob there came out of the anterior sulcus. It can take time consuming. So as long as you just dedicate a little bit of time to this patient, you debride them well, and then instruct them on some ear hygiene, topical oils and earwax softening drops to use in between the use of his hearing aids, then usually you can keep these problems from happening. And then occasionally you just need a frequent or periodic scheduled visits to your local ear, nose, and throat surgeon where he can take care of you. I wouldn't recommend flushing this out. That would be a bad move for a fungal otitis externa. That's just going to make things worse. Usually microsuction debridement is going to be your best option for making this go away. And it can be very aggravating at times, and sometimes requires multiple visits. So here we are, right on the eardrum, just peeling up the last little bit of layer off of the eardrum. And once we get this off, I start him on some drops called cortisporin. It's actually an eye drop, but it works well in the ears. So any drops that are prescribed for the eyes can be used in the ear, but you can't use drops that are formulated for the ear on the eye. So cortisporin is my go-to. The other options that we have are some neomycin-containing triple product solution. It's antifungal, steroid, and antimicrobial. You can also use over-the-counter. You can grab some alcohol, just plain rubbing alcohol, or isopropyl alcohol, and then some regular either white vinegar or apple cider vinegar, and you make a 50-50 mixture of that, and you get a little dropper from the pharmacy, and you can use that and treat an otitis externa as well. And sometimes you can use that as a long-term maintenance for some people. Some people have recurrent problems, and for instance, I've got one gentleman that he gets these recurrent ear canal infections, and most of it's fungal, and we try and keep it at bay by treating his ear topically with the alcohol and vinegar. But thanks for sticking around to the end. I appreciate you watching, and let me know what you think in the comments below, and have a great day. See you on the next video.